and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Today, Brad, top 3 ACL range of motion exercises or stretches that you should perform after surgery.
Right, and this is pretty much within like 2 or 3 weeks after surgery when that knee is tight yet, sore, you cannot straighten it, you cannot bend it very far.
All right, you're shooting for both. Get
Exactly.
it straight or get it bent, more bent.
You better believe it. So you're going to have to get off the table.
All right, let's go.
All right. Nothing fancy, and that's the best exercises are the simplest ones.
That's right.
In this situation, you need a slippery surface or something you can slide your heel on. I'm just going to put a towel down on this vinyl plinth, and the knee will typically be like this. Most of the time it won't straighten, but we're going to think about bending it up and just do a little scrubbing, if you will, or working that heel across the table. You can do this on the floor. If you do it on carpeting, you can use a plastic bag to make the carpet slippery for you. And it's certainly okay to help bend it. When you start to get to that part where it starts to stretch and hurt, don't go too far. Sharp pain is no good.
So you can do it in a seated position, Brad?
Yep, you can do it seated. It's a good point, Bob. Or if you want to do it laying, you can do it laying. I've got 2 people with ACLs right now, and I always have them at this point. They take their other leg, and they'll just push it up to stretch it a little bit more, and so the other leg will help.
Sure. Gotcha.
You can also do this straightening, and just right here, let it down like this, and let gravity straighten it out.
For a little stretch.
Yep, and you can take a towel roll like this. So there's a little air gap. Can you show that, Bob, right under the knee?
So right under here, he's got a gap, and the knee's not straightening all the way, and he's going to let gravity do its thing.
Exactly. This is one of those nice exercises you can relax and let gravity work for you.
Yep.
Okay. Now, the next point, or Bob.
Sure.
You want to grab the ball? You got yourself an...
It matches you.
Yeah, what do you say?
Yeah,
not
nice.
bad, huh? Color-coded today.
What say you?
What say you? Exactly. Okay. Here we go. Knees up here, and you can straighten it a little bit. Here's my good knee. Here's the one with the new surgery. We'll pull the pant leg up. There you go. Look at that leg, huh? Forget that. Anyways, you can do a little straightening on here like you did before. And then the nice thing is you just use a strong leg. You see this leg is pulling the ball in. Stretch, 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 and down.
Right leg's pulling the left leg back.
Yep, exactly. Stretch.
Put it into a stretch.
Exactly. Ooh, that feels good. You can work that 10, 20 repetitions until it's sore. You'll know when it's time to get done. Okay. Now, there's more. But wait, there's more, Bob.
By the way, I've seen a better leg on a kitchen table and a chicken.
Oh, yeah. Be careful. Be careful, Bob.
All right. Am I up?
Are you up?
Am I doing prone?
Yes, of course,
Okay,
Bob.
I don't need this, do I?
No, Bob.
Okay.
Actually, you got to go the other way.
Other way?
Yeah. Now, this is, again, easy stretch. You're going to feel this one. This is how you get the knee straight.
Is this the one?
Yep, this is the knee that had the surgery. You can do this on a bed if it's a firm bed at home. And you can see, bring it up a little bit, Bob. Here's the good leg, and it's nice and straight here. And this is the one that's had the surgery, and Bob would be completely relaxed right now, and that's as far as we'll want to go sometimes. And you're just going to relax and let gravity go, and with time, you're going to see Bob's legs stretch, and it's going to go straighter, 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 straighter. And I never have my patients hang like this more than 5 minutes, and if it's really uncomfortable, it may be less. Sometimes this can get pretty uncomfortable, and you always have the kneecap past the table, because if your kneecap is on the table, it's uncomfortable and it's doing no good whatsoever.
Will you use weight, Brad, or not?
Sometimes I will put weight on the ankle, maybe 1 or 2 pounds. It all depends. Don't make the stretch so bad that you're screaming and yelling. Use good judgment. It's going to be a little uncomfortable, but if it's too uncomfortable and you just can't bear it, you're not ready for this one yet. I've got one coming up that you will be ready for. All right.
You don't want to be calling your physical therapist a physical terrorist.
Right. Yep. Exactly. Or what is that other one? PT stands for pain and torture.
Pain and torture,
Yeah.
right. We heard them all.
Yeah. Don't go there, Bob.
Okay, seated.
We're really nice people.
What do you need for seated now,
I
Brad?
need the towel.
Towel.
Yeah.
Okay.
So if you're on a smooth floor, you just put a towel down, or you can do it with your sock on. Anything to make it slippery, and simply get the knee. This is to get it to bend. And you can push it in like that. Use a strong leg and just push it in. You got that in there, Lonnie? It looked like the camera's pointing towards Bob. I'm the one doing the thing now. Keep me focused.
If the camera breaks, then we'll know it's on the right person.
Yeah, no kidding.
Now, if it gets back so far, Brad, then at some point you want to take the heel. Instead of going here, you go off the toe.
Yeah, because eventually you're going to want to get up to that 100,
Right.
110, 120 and further range.
Right.
And have a seat on the ball, seeing how we're doing this. You can actually just sit on the ball.
And rock.
And yeah, now you're pretty far advanced. Pretend that's
Yeah.
This is a little tricky because you got to be comfortable on the ball. You can fall off the
Probably
ball.
about the right size, too,
Yep,
for you.
yep.
Which is probably a little low for me. But
Yeah, that ball is too small for Bob. Bob's a tall guy, and that
But
ball.
you can do this in a wheelchair, too.
Yep.
You can rock back and forth, and you can do it on the ball. Probably
And-
a glider rocker, maybe.
Sure. Yep.
Yep.
Anything that you got at home, we're going to take a stool. If you got an ottoman at home, because you probably don't have a stool like this. And this is to get it straight. I mentioned sometimes laying on your stomach, the prone hang Bob was doing before, is too painful. This one you can adjust so it's not too painful. And you can put a cold pack on, which you have to do anyways to keep the swelling down. At the same time, acts as weight. It cools down the knee for inflammation. Battle that a little bit, Bob. Am I forgetting anything?
Nope, you're cool.
And if you want to be aggressive, you put your heel out there and you let the weight push it down, because it may start like that. And you can do a little pushing, reasonable stretch pain, not too much. And if you're going to have the cold pack on for 15 to 20 minutes, most people, my patients, I'll have them stretch hard for maybe 5 minutes, and that's enough.
Well, that, and also what I have people do is give themselves a break. So, like, let's say you've done it for a minute, it starts to hurt, then I just bend it for a little bit.
Pull it up like this?
Give it a
Yeah,
break.
sure.
And then go back into it again.
Yep, that's a good option too.
So, but 5 minutes total.
Yeah, and then just bring it up to here.
Right, and it's nice and relaxed.
And then you put a big smile on your face and it feels good.
Yeah.
And it's just a cold pack cooling down the knee. This does feel good, Bob.
All right.
I'm getting pretty happy here.
Okay.
All right,
Remember, we can fix just about anything, bud.
except that broken heart. But I'm thinking we can work on that. This gives me another idea. We'll come up with it next time.
He's always thinking.